York's classic rock, Q1043.
Good morning. I want to introduce you to Nick Rolnick. He is a world-class performance trainer, a performance enhancement specialist, and physical therapist at his Culture of PT PLLC here in New York City. What does it mean to be a performance trainer and enhancement specialist? These are terms I have not heard before.
These are most likely terms that are thrown that are, colloquially known of being a human performance specialist. But in reality, I view myself as the human performance mechanic, and my skill set as a physical therapist, as well as a personal trainer, is one that is surrounded by the philosophy of activity. And with that, I commonly see people that come to my clinic, they're in pain or they're having some sort of issue that's preventing them from getting back to the activities that they love. And the way that I view the body in general is like a machine, and a machine functions optimally when there's balance in the system. And when I see pain or, for example, anxiety or something where the system is out of balance, well, then it's my job as the human performance mechanic to go in and find the actual cause, or what we would like to believe is the cause, so then we can come up with a plan in order to help them get back to the activities that they love as quickly as possible. So with that philosophy, it's heavily based in movement and physical activity, because if you look at the research in general, exercise tends to be the most well-supported intervention for a variety of different conditions, whether that's musculoskeletal, whether that's mental health. Really, the benefits of exercise don't just stop at physical benefits. And that's why it's such an empowering position that I find myself in on a day-to-day basis, because I get to do what I love with people that are in pain or are looking to better themselves. And it's really rewarding to be able to change their lives. And so I'm just fortunate enough to have found my passion and live it every day.
That's like the total blessing of life, I think. I mean, one of the big blessings of life. I say that myself all the time, that, I don't feel like I work for a living. My only work is getting up at 1:20 in the morning when I come in studio, right? Your eyes said it all. Like your body never gets used to that, but that's the only work, because if you love what you do, even on the worst day, it's still a good day, because you're just enjoying what it is you do. And then you never want to retire from what it is you do, because then you're not doing what you love anymore. All right. I wanted to ask you specifically, when people, that weight training is stressed a lot now, besides aerobics, we're told that we should do strength training with weights, but you have a system that you have mapped out for people who can't lift weights, and you call it blood flow restriction. I've never heard of this.
So
Again, what is that?
Yeah, what is blood flow restriction? Well, first and foremost, I must say that I am not the inventor of this technology. This technology was developed in 1966 by a bodybuilder, actually, because it has its roots in bodybuilding, trying to increase muscle mass and strength. And really, without getting into the nuances of its foundation and application, basically what blood flow restriction training allows me to do with my patients is be able to exercise at lower intensities, something like 20 to 30% of the individual's one repetition maximum. So very, very, very light weights. And when doing blood flow restriction training, what's happening, it's like, you can think about it, everyone has gotten their blood pressure taken at some point in their life. Well, that blood pressure cuff is, we apply when we're doing BFR, we apply this cuff that will selectively reduce temporarily the amount of blood flow that goes to that limb. And when when it does that, we're able to mimic the environment of a high intensity exercise training without having to go into that heavy lifting. And I think the easiest way to think about it is when I talk about blood flow restriction training with my patients or clients, is if you've ever been familiarized with the pump. Have you, like when you're exercising and your arms are really stretched out, legs are really stretched out, and it feels almost euphoric. Arnold Schwarzenegger back in the 70s was the first person to really popularize the term the pump. And what we know about the pump is that when we're exercising with light weights, with moderate weights, or with very heavy weights, if we're able to get a pump, we know that we're producing positive benefit to our body. Is improvement in muscle strength, improvement in muscle mass, improvement in our ability to deliver blood flow to the exercising muscle. All of these things we can look at through the lens of, if we are able to get a pump, we're going to be able to elicit those positive benefits. And so with light loads, unfortunately, when I'm dealing with people that are deconditioned or they're not able to lift heavy weights for one reason or another, blood flow restriction training is a tool that I can use to help people get that pump with very, very little to no weights at all.
Wait a minute. So do you actually put a cuff on them?
Yeah, so it's a medical device that is calibrated by some sort of technology, and that could be a computer, that could be manually via a Doppler ultrasound. And what that just does is it allows us to be very precise, or more precise, with the stimulus or the restriction that we're going to be giving to the arm or the leg at any given point. And a temporary restriction where we're exercising with BFR, which is no more than 8 to 10 minutes when we're doing resistance training, that allows the body to basically feel like it's lifting a ton of weight when you're really lifting little to no weight at all. So it's that cuff that when appropriately applied, will accelerate the benefits of using very light weights. So that actually was a prime strategy for my practice as a personal trainer and a physical therapist during COVID, when I was, everything was shut down. People were looking to harness whatever they could to stay fit and healthy and avoid what I now have heard is the COVID-19.
I hear it's more like 30.
But yeah, so with using the technology that's available now, I was able to continue to train or see my patients that I couldn't see in person, and I could see them remotely because the technology is there to allow for more remote use with the technology. So
wait a minute, but they would have to get this device, right? I mean,
yeah. So the devices, they vary in price across the market, and typically, your primary exposure to blood flow restriction training is likely to be with a physical therapist that's trained in blood flow restriction training, just because the applications of blood flow restriction training, even though they derived from bodybuilding, they were popularized in the clinical setting, because people that are injured, what happens to our body when we're injured and we're not able to exercise, and this happens pretty rapidly. Within 1 day of complete bed rest, we're fine. 2 days, there starts to be changes in insulin sensitivity. And 3 days, we can note that we lose muscle mass on MRI. So what that means is we need to find ways to challenge ourselves in the post-injury period. And blood flow restriction training allows us to do that, to avoid the loss of muscle.
I am speaking this morning with Nick Rolnick. He is a world-class performance trainer, performance enhancement specialist, and physical therapist at his Culture of PTP LLC here in New York City. And he uses a technique for those who are too injured or who can't lift weights. It's called blood flow restriction. Is this device covered by insurance, and how much is the expense?
Yeah, so the cuffs, it depends on, how precise you want to be with your application. When I'm working in the clinical setting, I want to use medical grade devices that are able to restrict I can know basically how much restriction is occurring because the device has been studied in the research base. There's a ton because BFR is exploding in popularity. You know, I mentioned its application in the clinical setting, but now it's really exploding into the fitness setting. So the everyday gym goer, for example, somebody who's in their mid 40s, 50s, was an ex-athlete, or somebody who's an exercise enthusiast, but they have knee pain or elbow pain that is preventing them from continuing to maximize the therapeutic benefit of their exercise routine. Blood flow restriction training is an excellent alternative to start working into their program to continue to stimulate their muscles to the same degree. Because I know that we talk a lot about muscles as being
But
some.
again, is it covered by insurance if people want to, if they
So
come to you or whoever, is it covered?
yeah, so blood flow restriction training would be included in whatever physical therapy session that you'd be doing with your provider or chiropractor. It is part of a therapeutic intervention. It's not something that is like, yes, people can go in for blood flow restriction training specifically, and I do have some of those clients, but as part of the blood flow restriction, it's just as part, it's a modality that can be implemented to produce a specific effect for the patient, and usually that is improving muscle mass and muscle strength, and more recently actually producing some significant pain relief that allows for individuals to recover faster and be able to exercise maybe at a little bit higher intensity because of the desired the outcome of the blood flow restriction. But it's pretty cool. Like right now, it's, the research has come out on a variety of different ways to apply it. I know we talked about what's the cost. Well, you can get a BFR band on Amazon for $30 if you really want to, but it's not going to allow you to really do things as precisely as you need to do them. And so other technologies that exist are a couple of $100s, but then they'll allow you to harness the benefits of blood flow restriction training and maximize the safety.
But this is, again, only for those who can't lift weights because of a specific situation, or can this be a replacement of the typical strength training?
Either or. So for example, like what's really cool is we're able to, blood flow restriction training is actually challenging our understanding of how we produce adaptations. For example, like initially there was the thought that yes, it was, for the rehab setting only. But what we're actually finding is that with elite athletes that need to maintain or improve their aerobic capacity, but for one reason or another can't continue to add more low intensity training volume, we can actually substitute out some of that training volume and actually improve their performance in less time. So it's the benefits are yes, rooted in individuals that are what I would consider load compromised. They're not able to lift heavier weights, but they still want to get the benefits of high intensity training. And now it's transcended into the general fitness applications, because everybody that goes to the gym that strives for muscle mass is going to be able to benefit from its inclusion in some capacity. Now, obviously, because we are restricting blood flow, we also have to consider that there is, we want to make sure that we're being appropriate with the safety screening. And that's where it comes into play, where I've written some papers regarding the application of blood flow restriction training in medically compromised patients. But the cool thing is that even with those potential elevated risks, the reports in the research are almost non-existent regarding the negative effects of this, even in very at-risk populations, which is awesome, because you think about blood flow restriction training and you're like, wait, why would I want to restrict my blood flow at all? Don't muscles need oxygen?
Okay, very quickly, because we're out of time. If people have more questions, how do they contact you?
If people have any more questions, they can contact me on my website, www.thehpmny.com, or I'm most responsive on Instagram. at the HPM.
Okay. Fascinating. Again, you taught me something totally new. And if you missed any of this, you can download the iHeartRadio app. It is free. And all of my interviews live on under the podcast Sunstein Sessions. And I'll see you guys tomorrow on the Jim Kerr Rock and Roll Morning Show, Q104.3.
New York's classic rock, Q1043.